orthopedic surgeons and countless other doctors. And you came here with a variety of joint pains. And one of the things that struck me is that the only time you ever felt better is when you took prednisone for any or unrelated reason. That is almost irrelevant what the reason was, but you took it and you got better. In addition to that, you have had concern and have been told that you have osteoarthritis, or you're crazy, or there's nothing wrong. We've got very firm evidence that you brought me at your first visit, which indicated you did in fact, or do have osteoarthritis of your left hip related to ephemeral acetabular impingement. You do have flat feet. You do have perhaps osteoarthritis of your ankles. And the issues that I had problems with were, one, the steroid, and two, you had several other things that did not fit with osteoarthritis.
I'll tell you, your injections helped me immensely. Then in my ankle.
Maybe I forgot to document that I injected you. So please forgive me, but what did I inject?
You inject Epimetronol.
No, what joints did I inject?
The left ankle, the left knee, and the left hip.
Okay. So we did the left ankle in the office that day. We did the left knee, and yesterday or later that day we did the left hip under fluoroscopy.
Exactly.
All right. So those injections all helped?
Yes, I mean, my ankle and my knee resolved much more than my hip. Okay. As you well know, my hip is pretty bad, so, you know. But it's about 70% better. I mean...
The hip is?
Yeah.
It may still get better. The shot was only done in the last 48 hours.
I know the steroid takes, because the ones I had before, they said a couple of weeks for it to take full effect.
It's peed out of the body in 5 days. So that's a positive, especially knowing with your sugar possibly.
Sugar's fine. Good, didn't even go up.
Okay, well that's because your hemoglobin A1C is well controlled. Fatty liver with no fibrosis is not a reason you can't take methotrexate.
Okay.
Some people would argue type 2 diabetes could be a relative contraindication. I don't conform to that because I've never seen a problem with it. Here we go. I did inject you and I did mark down that I did. There was something else that you had told me. When I did your Schober's test, when I had you bend forward, you failed that test with flying colors. Now, we could argue that it's because you've got arthritis in your lower back, or because you had disc surgery in Germany. However, you tell me that your range of motion is normal for you.
Well, it's better than it was before the surgery. Before the surgery, I couldn't even bend over. You know.
So there's still a chance that you might have some residual problem that is not your normal, but nonetheless, this test is not diagnostic, but makes the thought conceivable. Now, you had showed me your sacroiliac joints, which I believe had been read as normal.
The orthopedic was just doing his x-rays for my hip. He wasn't even looking at sacroiliac. I just showed you that picture of my disc replacement.
Okay, but I looked at them and they were abnormal.
Okay.
And I followed them up with an MRI, and you do in fact have sacroiliac disease. So, knowing that the sacroiliac disease did not get there yesterday, and knowing that those x-rays weren't taken yesterday, based on the nature of your pain, in spite of the fact that you have conventional pain, and the fact that your general pain of joints goes away with steroids, you have an inflammatory arthritis, and because your sacroiliac joint is confirmed abnormal in the MRI, you do have a spondyloarthropathy. Now,
and that's what I've always thought, because I've had all this arthritis.
Well, it's your fault. You should have come here sooner.
Yeah. Well, so I didn't waste my trip to come up here.
No.
I made a good move.
You made a good move.
Thank God.
And for everyone else out there in America.
And I'm finally going to have a chance of getting better instead of just getting consistently worse.
Now, you don't think I'm too cocky or arrogant the way I'm...
No, I think you've been great, man. I mean, it's almost bringing me to tears right now because, you know, I've been ignored and criticized and pretty much made to feel like a hypochondriac or somebody... Well, I've actually been put on antidepressants for pain, but they were probably thinking, this guy's depressed. Just wrong, I'm depressed.
You know what?
Because I'm in pain.
You should be depressed if you're in pain, not treated all these years.
And, I definitely got told that I was, my pain management doctor wanted to send me to a psychiatrist. And I refused, So it's tough. I mean, and what I really worry about is the people that don't have the due diligence that I have had to keep pushing and pushing and going and going. Even though it took me 15 years, there's stories out there, people have been 20, 25 years trying to get a diagnosis. And when they finally get it, it's kind of too late,
Pardon me. Denise?
Yes.
I have everything here except his HLA-B27.
Probably not that.
Yeah, I don't think the labs came back from the question.
So let me just explain to you what the HLA-B27 would mean to you. 10% of the population has a normal HLA-B27, whether they have no disease or some disease. So assuming yours is negative or normal, because you have got sacroiliac disease and inflammatory pain that responds to steroids, by definition you have a spondyloarthropathy. However, also by definition, if your HLA-B27 is negative, it is very unlikely at your age that you have a new onset of ankylosing spondylitis, even though it's not a new onset. You've had symptoms, like you said, 13, 15 years. So the sacroiliac changes that you have today, they didn't start at age 50, they started at age 30 or earlier. Yeah. Yeah.
I just went to my orthopedic surgeon 2.5 months ago and he said I'm fine.
But this is not an orthopedic.
I know.
So
but people don't know that. People don't understand that one doctor does this and the other doctor has no clue.
The general public thinks everything that hurts goes to an orthopedic surgeon because they do a lot of advertising and there's 100,000 orthopedic surgeons. There's only 4,000 clinical rheumatologists in the country.
Why doesn't anyone want to be a rheumatologist?
Good question. I
mean, I'd rather give people injections than cut them open and saw their bones out of them.
I would rather get an injection than have my bones cut up too. Okay, so if your HLA-B27 is positive, I would say psoriatic arthritis, Crohn's arthritis, reactive arthritis, uveitis, and several other conditions. This 50-50 positive HLA-B27. You can have psoriatic arthritis without psoriasis. You can have Crohn's disease or ulcerative colitis without bowel disease. You can have any of these. However, if the HLA-B27 is positive, at your age, I would expect to have worse axial disease. Now, you and I went over your x-ray together, and you had entire abnormal thoracic and lumbar spine. However, the changes that you had, some of it looked possibly inflammatory, and some of it looked to be non-inflammatory. Now, you're not a long-standing diabetic, but diabetics do get DISH. And DISH, which is diffuse idiopathic skeletal hyperostosis, is seen in diabetics. Now, again, yours was not a classic anterior fusion, which is what you see in DISH, where the contiguous vertebrae, 3, 4, 5 in a row, are fused. Yours was more of like a bamboo spine that never got there yet. And on my x-ray read, both sacroiliac joints had partial fusion at the bottom. The MRI only showed disease on one. But, there's going to be some difference of opinion. I'm very comfortable with the radiologist here. So the fact that you have any sacroiliac disease, albeit luckily for you not active on bone scan, you have an inflammatory spondyloarthropathy. And we already know for a fact you get better with steroids for your peripheral joints. And to get rid of your back pain, you'd warrant a 6-month trial of a biologic, probably Remicade.
I'd like to do that.
Okay, so...
now, let me ask you this. I've been taking endomethacin for about 11 years.
I'd love you to stop that.
I would love to get off of it, but I read that before they had biologics, that people with ankylosing spondylitis or with these spondyloarthropathies, that was the drug that they used. Now, can it slow the disease down at all, or just get rid of the symptoms?
Indomethacin cannot slow the disease down at all.
Okay.
Prior to biologics, patients with axial disease were addicted to morphine. indomethacin has no effect on the axial skeleton whatsoever.
Oh, so it doesn't help with that thing.
No, it helps the DIPs, PIPs, MCPs, wrist, elbows, shoulders, hips, knees, feet, ankles.
Well, nothing gets rid of all my pain, but that gets rid of more of it than anything else I've been taking, including opiates. You know,
when you took steroids,
whether I got a shot in my butt,
took away all your pain except your spine.
Yeah, well, nothing ever always goes away, but yeah, my joints definitely got more relief than anything else. Yeah.
Correct, and that's what I would expect, and that's why I'm comfortable telling you that you should have a 6-month trial of Remicade.
I actually am happy to hear that, even though that's supposed to be the bad arthritis, because like I said yesterday,
that's okay, because now
the good arthritis you can't do nothing about, and that's horrible. You know,
well, the good arthritis, if you have a precision injector, you can do quite well. But the bad arthritis is now remittable.
No, that's what I want. I mean, I wanted to be able to do something, even though people are afraid of these drugs. And
they're not.
I know people on them and they don't even know they're on it. You know what I mean? The only people that seem like they have a problem is the ones that get put on it by doctors who don't check them for hepatitis and tuberculosis and other things, cancers, and put them on it, and then later on they show up with these chronic diseases because they weren't screened properly.
Well, that's a problem.
And that's why you ran all those blood tests, because you want to make sure, even though some of them you repeated, because I just had my hepatitis checked 4 months ago. But I said, well, I could have got hepatitis again in 4 months, So.
But you might not have been checked for hepatitis B, you might have only been checked for hepatitis C.
Right. Well,
and frankly, you can...
And it came from another hospital that hasn't been able to diagnose me for 20 years, so maybe they didn't do the test right. I mean, you never know. So you got to do your own stuff.
But you can have biologics on with hepatitis C, just not hepatitis B or HIV. And of course not with TB. Latent TB has to be treated for at least 3-4 months prior to starting a biologic.
So are you going to put me on methotrexate regardless, or first, or are you going to...
I always combine methotrexate with biologics.
So they can work together.
They potentiate each other, yes. You'll need your liver functions monitored every 2-3 months.
I've been doing it every 3 months with my internist. She checks that every 3 months. And I can get it done every month if I need it.
And I'm hoping that was because of your indomethacin use.
That, and just because my internist really always thought that I had something going on. Her mother has rheumatoid arthritis. And she sent me to these 3 rheumatologists. But they just dropped the ball, And I mean, she couldn't do nothing. When I told her I was coming up here to see you, she was happy for me. She was like, I hope you can get, something done, because my mother's, can't get good care. And she's a doctor, her daughter's a doctor, but she's an internist, and she doesn't know much about arthritis as far as rheumatoid like you do. I mean, I know you're an internist as well, but you have to be an internist first and then become somebody even more specialized, So she'll admit, I can't help you, and she'll send you to somebody else. But then when she sends me to somebody else, they don't do anything. What can she do? So she was checking me. She checks me really close to see if something that she can control and see gets out of whack, and then make a move, because now it's really. But then once they see it in your blood work, things could be much worse than you'd like them.
Just remember, we never treat the blood. We have to listen to the patients. That's why you've been blown off for so long.
Right, well, nobody listens to me. They look at the blood work and the test, the few that they do. Like, I had one of the rheumatologists just did a RA factor on him. That's it. And he came back negative, and that was it. That one test. That was the only test. Never asked me nothing. Never looked at any of my medical records. And so they didn't even really know the extent of my disease. They were just like, no, we're RA, you don't have it.
And even the joints that hurt were never injected.
They never even touched my joints. They never even did a physical examination. 2 of them didn't even do a physical examination. And the one that did do a physical...
So you drove 1,200 miles to get examined?
1,350 miles. And that's going to be 2,700 altogether. But I am so happy that I did it. But the thing is, what I worry about more... I'm happy for myself. But what I worry about is the people that take every doctor's word for gospel, and they just have no hope. And because a lot of people feel that way. A lot of people don't. It's like you're the president of the United States and you don't want to offend or ask too many questions or play. And they don't know. they don't, I've had some college and I've had to study and research in my career. Every day I got to learn something new, so I have an analytical mind. But the average person is just whatever a doctor says to them, and that's it. And most of them don't want to be here in the first place. They don't want to come to the doctor. They don't trust doctors. They don't have the money, the time, and they just want to get in, get out. And the way it is with most internists now is they just blame everything on you. You lose weight, you change your diet, it's your fault, it's your fault, it's your fault. I've been getting that. Like I told you, they said I had metabolic disease. And I have been eating, I eat 20 grams of carbs a day if I eat carbs. That's nothing, it's 2 slices of bread. And my A1C has been...
I get more on a scoop of ice cream.
Right. My dad loves to eat, and he and I cannot have that social time together because he eats buffets and piles of food. She probably eats 5,000 calories a day. If I did that, I would be very sick. So we don't go out to eat anymore. You know, I cook most of my own food, but I get no credit. No credit for having an A1C of 6 or 5.8. It's a lot of effort goes into it. I can't eat. I'm from New Orleans, and we have the best food in the world. I'm a great cook.
And you will tell me the best restaurants when I go down there.
In the world.
Yeah.
But like I told a client that might be coming from Montana for you, I said, man, sometimes you gotta go where the talent is. But nobody, the sad thing is just nobody else, a lot of people can't do that.
No, they can't. And the sad thing is there's a shortage in this field, and the people that are in this field are not necessarily in it because it's a career. They're in it to just go to work.
Well, I'm thrilled. I am, because I have some hope now that I can feel better.
I think you'll do fine. I'm pretty
And I'll definitely, it's no problem for me to come up here twice a year, you know, and get some injections and follow up with them. I'll definitely do that because there's nothing down there for me to do. You know, I mean,
frankly, if the Rheumatologist works the way it should,
you might not need
your need for injections is going to go away.
What about the insurance companies? I know these drugs aren't free. I heard that I have a friend that has rheumatoid arthritis. They want you to put them on methotrexate.
No, well, that's automatic.
Right, because it's cheap. You know?
No, but you do need the methotrexate with the Remicade, let's say. And the insurance is, for the most part, if there's a justifiable reason, they are covered.
Yeah, I was a little worried about the biologic, not about the drug, but about it being covered when I was reading about the dish thing. Because dish is idiopathic, so they really...
But you have sacroiliac disease.
Right, good, because if you have dish, they may not pay because...
They shouldn't.
Because it hasn't been proven to work. It is being used off-label,
but
for dish. Hasn't proven.
Dish is a form of osteoarthritis.
Yeah, when I left the hotel room this morning, I told my dad, I said, I hope I don't just have plain old osteoarthritis again because I'm going to be disappointed. I wouldn't have been mad with you, but I'd have just been mad that it, you know, because I wouldn't have nothing else to do. I'd just keep taking medicine until I blow a hole through my stomach and bleed out. And because you're not supposed to be taking NSAIDs for freaking 30 years, you know. I mean,
well,
thank you.